Welcome to UMHC Take 2. I'm Dr. Jason Kraft, an orthopedic surgeon with the University of Mississippi Healthcare. In this edition of UMHC Take 2, we're going to take a look at a new solution to a problem which has been commonly misdiagnosed for years. Have you ever experienced a recurring groin pain that may feel like a pulled muscle or like a stabbing pain despite rest and therapy? Many times it's something called hip impingement. Undiagnosed, this can lead to a painful hip with loss of activities in younger patients and early arthritis in older patients. But now, with proper diagnosis and early interventions, sufferers can live pain-free and even return to competitive sports. Impingement occurs because of an abnormal contact between the ball and the socket of the hip joint, because the ball in the joint is not exactly round or has bone spurs. Over time, whether you have bone spurs or an abnormally shaped ball, either will rub on the surrounding cartilage, which serves as a gasket between the ball and the socket. The cartilage wears down or tears, or both, causing the pain and possibly arthritis, which occurs when bone meets bone. The condition is often congenital and can also be acquired during the growth of a young person by excessive and repetitive stress across the hip. To diagnose this problem, we get very specific x-rays and do certain exam maneuvers. If we suspect impingement, we order an MRI with dye injected into the hip. The dye highlights any tears or worn down spots in the labrum or cartilage so that we can see these injured areas better. The dye is combined with a numbing medicine, and if you get relief for a couple of hours, then we know the pain is coming from inside the hip and not your back or other areas. Years ago, the treatment was a complex surgery. We had to make a large incision, cut the femur, and grind down the head. Today, it's an outpatient procedure, taking a couple of hours, followed by a few months of physical therapy. The patient is numbed from the waist down and put in traction to gently open the hip joint. An arthroscopic camera is inserted through small incisions, and instruments are placed in several other small incisions around the hip. We use a burr to remove the areas of impingement. Shavers placed inside the joint will remove the frayed and damaged cartilage. Patients are on crutches for 2 to 6 weeks, followed by physical therapy like riding an exercise cycle. Then the patient progresses with weight-bearing exercise like walking on a treadmill. By 3 to 6 months, the patient can be back to full participation in all sports. About 85 to 90% of patients get full relief from the procedure. Some with more severe injuries or degenerative condition at least see an improvement in their condition. Thank you for watching this segment of UMHC Take 2. I'm Dr. Jason Kraft. You can watch more medical procedures on UMHC Take 2 by visiting umhc.com.